It's more like pushing a straw into a juice box. The pointy end of the straw punctures the opening, and the film is pushed out of the way. This was an awesome answer. Skin isn't like cheese. Skin is very flexible. The point of the needle creates an opening. The arc of the needle widens the flesh opening. Think about when you use a boba straw. Similar shape to the needle and follows the same concept on the plastic lid. Skin isn't like cheese. IDKY, but this has me wheezing. Why are you trying to drink cheese through a straw? Do you not? Actually, I think a critical point is being missed with many of the explanations. For an injection, the needle is almost always filled with an incompressible fluid, like water, so the skin won't enter as it can't compress the fluid. For a biopsy, even air, which is compressible, will be enough to push skin, epidermis, dermis out of the barrel of the needle. If I needed to biopsy the full thickness of skin, I'd start to pull on the plunger to put a vacuum inside the needle immediately as I inserted the needle. Otherwise the needle would be, almost completely, empty after insertion. I guess biopsy needles must have a flat tip. So for injections the angled needle must be important both for pushing into the skin and for breaking vacuum. The vacuum would only be a factor until the angle is below the skin, so I'm guessing the wedge shape is more important than the pressure. A hypodermic. Hypo equals beneath. Dermis equals skin. Needle is a thin, hollow tube with a sharp tip at an angle. A bit like an arrowhead. So the point pierces the skin and downward pressure expands the incision and allows the needle to pass through the layers of skin. Skin is elastic and flexible unlike cheese. The big ones, which I doubt they'd ever use on a living patient, do. Used to find little skin and fat plugs in cadaveric blood samples all the time. Gross. Already a ton of explanations about how it doesn't happen, but many are missing the fact that skin plugs do happen occasionally. About 1 in 150 blood donations ends up with a skin plug. It does, it's just not noticeable. We take biopsies of things like thyroid nodules in the same manner. Use a bigger needle and depress it into the lesion while the syringe is under negative relative pressure. The material ends up in the syringe and is transferred to a slide for review. So you're actually right. It works more like a Capri Sun, except with less tries, and you typically don't accidentally push the needle out the other side of the body. Cheese is mushy. Skin isn't. Skin also has some tension, which means as it tears it pulls itself out of the way. It'd be more like pushing a straw through plastic wrap or a t-shirt than cheese. If you put your finger in the other end of the straw before you push into cheese, it will not fill up with cheese. The air will keep the cheese out. Same concept with the needle. It already has a finger on the other end of the straw. Because unfortunately people aren't made of cheese. I think the world would be a better place if they were. Pass. The CS lab at university already stunk enough. The hole is on the side, not the tip. The tip pushes the skin out of the way for the rest of the needle. Also, skin is a bit elastic, so it wants to pull away from the needle ever so slightly, preventing any flesh from jamming up into the side opening. I would say the hole is at the tip tbh. It certainly starts at the tip. There's a sharp angle cut into a hollow cylinder to make the hole. Because skin separates due to tension, tarring cheese is a consistency and breaks apart more easily. So skin doesn't need this because of its composition. But when you have a device implanted called a port-a-cath for infusions, the needle goes in silicone and you have to use a special needle called a Huber or a non-coring needle. It has a curved tip so it won't cut a chunk out of the silicone. Here is a brief thing on how it works. https://www.verywellhealth.com/get-to-know-your-huber-needle-for-43073 https://www.verywellhealth.com/get-to-know-your-huber-needle-for-chemo-port-access-43073. Short answer. Skin isn't cheese. A hypodermic needle would also fill with a cylinder of cheese if pushed into a block of cheese. Skin is made of cells. The needle is sharp enough to push between them, and not collect them, like a semi-solid block of cheese. Although there is a beveled tip designed so that doesn't happen, a simple explanation would be that we administer fluids through them that infiltrate the tissue. We don't just stick them into tissue for fun. LMAO. The amount of cheese in our skin is insignificant enough to where you don't have to worry about that. As has been said, the angle of the opening and the elasticity of the skin shroud prevent this from happening. When on occasion a hypodermic needle needs to pass through a thicker tissue, such as the chest wall, needle thoracocentesis, or the throat, needle crocothyroidotomy, there is a theoretical risk of this happening. In these instances it is best practice to aspirate, draw back on, the syringe to remove a possible skin plug. Aspirating is always required, but that's more to ensure you are getting the right thing, or lack of thing, proving you're sitting, rather than to remove a plug. Never in almost 30 years of doing many things with needles have I aspirated to remove a skin plug. A hypodermic needle does not punch, but rather it cuts the skin. If you look closely, the tip is V-shaped, with two sharp blades. These make cuts into the skin, and the rest of the needle slides in. Sometimes they do. I was giving blood once and it was flowing much more slowly than usual. The nurses tried resetting the needle in the vein several times, ouch, but it never improved. So with only half a bag full, they gave up and pulled it out. Then they said some tissue had clogged the needle. The next day, the entire inside of my arm was bruised. Good times. Came here to say this. They never started since it was completely plugged for me. They went to the other arm after having 3 different people stab around for a bit. Fun times. They realized the issue once they decided to give up on the left arm. This only happened once out of all the times of donated blood. The same reason you don't get plastic when you stick a boba straw through the plastic top of the cup. The angle of the needle makes sure that one side goes in first, and the solid side of the needle widens the hole without cutting a plug. Think of a hypodermic needle point more as a knife with a hole in it than a tube. The tip cuts into the skin and the sharp edge of the needle widens that cut to match the width of the needle, maybe slightly smaller since skin stretches. Now with this cut the needle can go in until the hole is beneath the surface. The back half of the tip doesn't continue to cut because the elastic skin is pushed out of the way. A straw into cheese is making a plug because the cheese doesn't have the same elastic properties as skin, so even if you went at an angle to simulate a hypodermic needle, the cheese cannot simply be pushed out of the way, so the whole edge of the straw cuts a circle and creates a plug. Because straw doesn't have sideways cut on it. This way, needle makes little point hole on a skin and then widens it, whereas straw just cuts a large hole on whatever you try to puncture, even if you did it on a skin. Maybe because it's only pointy, and not sharp around the edges, which negates the coring effect, and 3 slant afford the penetration. The point of the needle is slanted. The leading edge creates a straight cut, pushes itself inside, then the slope guides the rest of it into the straight cut rather than cutting further.